Good afternoon, everybody. Today I'm going to speak to you about age and fertility. I think we all realize that as we age, certain changes will happen to our bodies physically, and we are also at risk of more medical issues. As far as fertility, for women, your most fertile age is when you're young, below the age of 20, and at least up to the age of 35. After the age of 35, fertility declines. Basically, if you're younger than 20 or in the early 20s, your risk of pregnancy is in the range of about 70 to 80%. Whereas once you go past the age of 35, it may reduce to about 35%. So just by that fact alone, it's important that you consider getting pregnant at an earlier age. However, we do know that in these times, people generally tend to get married a bit later in life, whether by choice or for other reasons. Now, and then when they do get married, there is also an intentional delay in most instances for professional reasons or for financial reasons that they tend to delay it even more. So that is important to consider when you consider getting pregnant. The other thing is when you delay pregnancy and you attempt to get pregnant after the age of 35, other considerations that cause a reduction in fertility. In particular, as one gets older, the number of eggs in the ovaries is reduced, the quality of the eggs or oocytes is also in decline, and there is also an increased risk of chromosome abnormalities. So, if you intentionally delay, then you are faced with these additional problems as well. Also, age in men affects fertility as well. While it is not as apparent as in women, it is known that in aging men, about the age of 45 and even older, there is increased risk of miscarriage in pregnancies and may be related chromosome abnormalities, although on a smaller percentage than compared to women. So one has to consider that if you delay pregnancy, you may then require more assistance when it comes to trying to get pregnant. So when you have to have treatment as you get older, the response to treatment may also be reduced. So for instance, if you have to undergo simple treatments like induction of ovulation, that may also be not so good as you get older. When the patient is younger, simple stimulation with pills or fertility pills usually comes with a good response. However, once you reach the late 30s, response to simple stimulation is less. And you will therefore have to embark on more intensive stimulation programs, for instance, using injectable hormones. Then the question arises that if you fail treatments in the simpler way, you may have to end up with treatments using more intensive therapies, leading up to IVF. And as one gets older in IVF, as I said earlier, the egg numbers have declined, the egg quality has declined, and chromosome abnormalities begin to increase. So therefore, when doing procedures like IVF, one may then end up with additional testing that may be required to be able to provide better results. Remembering, of course, that when egg quality and egg numbers are in decline, then the potential number of embryos of good quality that you produce in an IVF cycle are also reduced. So in general, one may say that if you are, for example, 38 and above, even with IVF, you may find that egg numbers in decline, therefore number of embryos may also be low. You may only be able to produce anything like 1 to 3 or maybe 4 embryos if you're lucky. Then also, because of chromosome abnormalities, if one tests those embryos, we'll find that when you're at that age, the percentage of abnormalities is in the region of 75%, as compared to normal embryos or euploid embryos in the region of only 25%. So therefore, if you are someone who is 40 years old, even doing something like PGTA, which is a pre-implantation genetic testing of embryos, if your number of embryos, let's say out of 10, you may only achieve 3 or 4 good embryos for testing, and when you submit them to a test like PGTA, you'll find that maybe you'll be lucky to get only 1 or 2 euploid or normal embryos for transfer. So while this assists in getting better results in the long term, however, you can appreciate that because of this issue of age alone, it affects patients and their outcomes. So, going beyond that, I think there is an issue about gamete storage that one can consider, especially in this more advanced age, and for the reasons I said earlier, where patients have either delayed for personal reasons getting pregnant. Then there is a consideration of oocyte or egg storage, which can be performed at a younger age, whether it's in your 20s or in your early 30s. If you're not ready to have a baby yet, one can actually consider storage at a younger age, because you will then avoid the issues of poor egg numbers, poor egg quality, and increased chromosome risk. So this can be for social reasons, and also storage of gametes may be also for medical reasons. For example, if someone has a disease like cancer, in particular breast cancer, or some of the other cancers requiring chemotherapy, then it is important to consider storage of gametes. In women it's called oocytes, in men it's sperm. Sperm storage is simple enough, but however for egg storage it requires that you undergo stimulation for development of adequate number of eggs, which can then be stored for future use. If the person is married, they may actually consider doing IVF and then storing embryos for future use. However, nowadays, with storage procedures being very efficient with good outcomes, oocyte storage is not a big problem and may result in good recovery of oocyte on thaw, so that they'll be available for you to use after completion of treatment or when you reach a later age. So these are important issues to have in mind. To avoid aging of oocytes, therefore, oocyte storage is an option. So to conclude, my advice to all couples is to, first of all, when you are married, you have a short spell in which to try for a natural conception. If after a year nothing has resulted, it would certainly be necessary that you should consult a fertility specialist to have assessment and advice regarding any potential problems. On a more positive side, you may also consider, when about to get married or in what they call premarital counseling, you may seek advice earlier as well, so that you'll be prepared for any unsuspected conditions which may relate to difficulty in achieving a pregnancy. So very simple tests can be done, other than having a history taking, a full physical examination to exclude any other abnormalities, assessment of your hormones, assessment of male semen parameters, are very simple tests to perform and can give you an early indication of whether you might be facing any potential fertility issues in the future. With that, I conclude this session, and if you have any inquiries that you wish to make, you may connect with our website, through our website, or call our number, which is there. Thank you, everybody.